Hey, Alethea.
Hey, Chris.
Thanks so much for doing this. This is Dr. Alethea Fleming, one of my really close colleagues and uh, co-mentors. I think we mentor each other through being doctors. And Alethea shared with me something yesterday, 2 days ago.
Couple days ago, yeah.
A couple of days ago, and I was like, "Oh, can we create a storyline about it?" It's about iron and fatigue. I'm going to just go through a series of questions, and we're just going to update her journey. So, because this is a common journey for women. You got some lab work, but I wanted to know what prompted you to get lab work.
Well, so originally the lab work was just routine, boring stuff that my primary had scheduled me to do in the spring. But like many of us, I had kind of delayed getting it done for a variety of reasons. I actually ended up sending her a message on my patient portal saying, "Hey, I've had a lot more menstrual bleeding recently. Can we add a ferritin on to the labs that we've already requested?" And so that's, benefit of my doctor brain knowing that that would be a useful measurement to have. So that it was partly boring normal stuff, but also partly this is not normal and how is it affecting me?
Nice. And so you got the ferritin back and you saw the number, and you can share that or not, but like it was low. What was your reaction, both sort of personally and as a doctor, when you saw that?
Right. So I got a ferritin level back of 5, and anything under 20 is considered really not good. But ferritin's a very confusing number, as maybe you've talked about in other circumstances, because it has a very wide reference range of what's considered normal. And those reference ranges are not optimized for different population groups, like people who bleed on a regular basis. Anyway, so I got the 5, and I had a combination of reactions. One was, "Oh, thank goodness, there's a reason that I feel this way." There is a little bit of feeling justified that it's not just I'm, getting old, which is my specialty. So there's a good reason. But also a certain degree of frustration and, oh crap, I've got to deal with this now. And, just the human nature of whiny, why me when I do all the right stuff? But mostly just, okay, at least there's a path forward to take to try to figure out how to help it.
Yeah. And so what was your initial step that your doctor brain might have known to do that other women might not know to do? What did you decide to implement before even talking to your doctor about your low ferritin?
Well, I heard about my low ferritin from my doctor. She called.
Okay, you did. Okay.
So that's how I got the news. And during that phone conversation, she had suggested, and rightfully so, that one of the first steps that we might want to take, which I agreed to, is getting a pelvic ultrasound, just to see if, is this normal perimenopausal excess bleeding, or is there something else that could be making it worse? So that is one step that we are taking, and I've got that scheduled for a little over in about a week. And then we'll kind of decide what to do from there. But on the other hand, just immediate first steps that any human being can take just from Googling, regardless of the fact that I'm a doctor. Number one, I cut myself a little bit of slack. And I think that's very important. When you have very low iron stores, it makes you more tired. It's not keeping me from doing everything that I would normally do. But if I'm running in the woods, which I still do, I am not running up the hills. And if I'm taking walking breaks, my running partner I'm just like, nope, we're stopping for a minute. Let's just walk for a moment. And that's okay. So cutting slack is good. But also just a simple thing of taking a good non-constipating iron supplement, which there are many wonderful ones available with just a little bit of information gathering.
Yeah.
To start from a dietary perspective of helping. I'm not willing to eat red meat, but people who are, I think that's a great option. Even using things like cast iron cookware more frequently, also a good option, and making sure that I'm not drinking black tea with my iron containing foods, because that binds it up. So just trying to get a little more iron in while
Yep.
we're waiting to figure out how do we decrease the bleeding. Although I am also now taking some herbs to help calm down the bleeding, which
Yep.
is helpful too.
If you're not a doctor and you don't know what those supplements are or what those herbs might be, a naturopath or a Chinese acupuncturist would have information on there. And so that would be an option to reach out to an alternative care provider and be like, hey, what would be helpful?
And I think that's a really great point to make in terms of why there can be such a beautiful complementary marriage between the conventional medical system and people who are slightly outside of that medical system. Because, right, my provider, she's an ARNP. I think she's great. But she's like, your ferritin's really low. Let's make sure you're not bleeding too crazy. We might need to do an ablation, or you might want to try oral contraceptives. And yes, those are options, but they are maybe not the first options that I would choose with my information as a naturopathic physician.
And none of that actually repletes your iron.
Correct.
Right.
Keeps you from losing more.
Keeps you from losing more. And probably it's going to be at least 2 or 3 cycles before that gets implemented.
Right.
And we're fast approaching full-time summer, which we want to feel awesome at summer.
Well, we want to feel awesome any time of year, but yes,
yeah.
I have literal mountains to climb in July, and I would like to be able to do that.
Yeah. And we'll do a segment about the physiology and why iron is important and stuff like that. But we wanted to catch Alethea at the beginning of this journey. Your next steps seem to be to get an ultrasound.
So I would say next steps are information gathering, right?
Information gathering.
Is there more information that we can get in terms of what my particular body is doing with this? But I'm also information gathering with things like I've put in a phone call to a colleague of mine in a nearby town who offers IV therapy to just discuss whether or not she would be comfortable considering doing an iron infusion with me. Haven't heard back yet, but I'm trying to get that ball rolling in case I make that choice. But yeah, other than that, I'm just gonna
and this is just one of the things that we see as doctors all the time. Like, we get this opening that something needs to be done, and I know personally I always want it done tomorrow, and
absolutely
it takes some time to manage and gather and decide, and so that we're just going to follow Alethea on this process.
Great.
Awesome. Well, thank you so much. We'll check in when we have a little more information.
Sounds good.
Okay, thank you.
You're welcome.